and welcome to the second episode, everyone. So this is the second episode of question and answers with Dr. Ipshita Johri. I'll be taking the first question that I have received. So this question is from Muhammad Hassan Ansari from Lucknow. He asks that I'm 16-year-old. I have very oily skin, blackheads, pimples. Please suggest which face wash should I be using. Okay. So first of all, having acne and pimples and oily skin in teenage is very common because this is the time when your hormones are changing, and at this time your skin becomes more oily. When the oil secretion increases in your skin, there are multiple pores in your skin. So the oil will clog these pores, and in the clogged pores, bacteria will grow. Also, your dead skin accumulates in this pores that is filled with oil, which is going to lead into blackheads and whiteheads. So oily skin is something very, very natural, very normal to have in teenage. Now when it is giving rise to so many blackheads and pimples, and you want to know that which face wash you should be using, so I can guide you that it is very, very important to clean the oil of your face to prevent further acne. The best face wash that you can be using is something that contains glycolic acid and about 2% of salicylic acid. So salicylic acid 2% is a very optimum formula that is going to help with the oil secretion in the skin. So it reduces the oil secretion. Not just that, it inhibits the growth of bacteria in your skin. So the formation of pimples, especially the pimples that are filled with pus, that decreases. Also, salicylic acid will help you in removing the blackheads because it loosens up the dead skin and the bacteria from your skin. Also, there is another recommendation that I would like to give, that is splashing of cold water on your face. So when you have oily skin and you have pimples, when you splash cold water on the face, it removes the oil and the dirt of your face. This should be done every 2 to 3 hours. If you have come from the sun, if you have faced the sun and the skin is red, if you see that the pimples are getting really red and inflamed, that is the time when you should be rubbing ice on those pimples. So you can apply ice for 5 to 10 seconds on those acne, and they will become much better. So that is about it. Another thing for the teenagers, I would want to tell you that do not scrub your skin because your skin is very, very soft in the teenage. So a lot of scrubbing, you think that the scrub is going to remove the dead skin and the pimples, but it's not so. It also damages your skin. So you will be getting redness and rashes on the face. So you need to stop scrubbing your face repeatedly. If you really want to cleanse your skin or remove the dead skin, you can go to a dermatologist and get a microdermabrasion every once in a while, maybe 30 to 45 days gap. That also in the case when you have too many blackheads and you just want to remove them. So you can take the help of microdermabrasion. So that's regarding your question about the teenage pimples. So now coming to the second question of the day. Second question is from Sachin Bhatnagar from Telangana, who asks, I use a dermaroller on face for acne scars, but my skin is becoming black since 15 days. Okay. So first of all, dermaroller, for those of you who are watching and you don't know what a dermaroller is, it is a plastic instrument like a roller which has small needles attached to it. So this is the instrument used by the dermatologists to boost your collagen and treat acne scars. Now first thing, Sachin, that I want to tell you is that you cannot use a dermaroller at home. It is not something that can just be bought and used on your skin because it can cause problems. So dermaroller has to be done by a professional, by a dermatologist, because when you see your face skin, the facial skin has different thickness in different areas. Like the area under your eye has a thinner skin. There are different bony prominences which will require a lesser depth of dermaroller. So all these things can be determined by a dermatologist. Also, for the Indian population, dermaroller is not for everyone because if you have a darker skin tone or even a wheatish skin tone where you have more melanin in your skin, in that case, dermaroller can cause injury which can lead to PIH, that is post-inflammatory hyperpigmentation. This is a phenomena where you get black spots or darkness in the skin after doing the dermaroller. So do not attempt dermaroller at your own. It is an excellent thing to remove scars, to boost collagen, for anti-aging, to remove wrinkles, but then it has to be done by a dermatologist in a controlled way. We check your skin and we decide if a dermaroller is actually the thing that will suit you. If not, then we use a microneedling radio frequency laser, which is a much better option in a darker skin tone or a skin which has more melanin, or if your skin is more tanned. So the decision has to be taken by a doctor. So that is about your question.